You said desiccate, and I was like, ooh, we got to talk about that. So, why on earth are you talking to me about desiccation, Rachel? What's going on with desiccation? Desiccate and demeanor. Demeanor actually
Mm.
disqualified me from a spelling bee back when I was very young.
And
I
you'll never
still
get over that.
very bitter about the word demeanor. So you said desiccate, and I was like, ooh, we got to talk about that. So why on earth are you talking to me about desiccation, Rachel? What's going on with desiccation?
Yeah, so that was another product that we talked about in the pre-show about services that the hygienist can add. Is there
Mhm.
is a relatively new product called Hybenx. They call it desiccation shock therapy. So it actually is desiccating and pulling all the water out of the pathogens in the sulcus and
Mhm.
any diseased tissue. So that's something else to research and look into as well and see how it fits in with your periodontal treatment protocol, because it
Mhm.
can actually be utilized in combination with scaling root planing to kill pathogens on contact. And it's very simple to place. I've used it as well and pretty affordable as well. So I think it's a great solution
Okay.
for just, trying to clear the field to give the patient's immune system an opportunity to kind of jumpstart healing after active therapy.
So this product, is it one-time use per patient or per tooth or per pocket? Like what's the
Yeah, it comes
how,
in a syringe.
okay.
So it's dispensed in a non-needle syringe, right? So it's just placed in the sulcus underneath the tissue. So the pocket of tissue around the tooth that typically is where the periodontal infection begins. So it's placed there. It can be used, at multiple visits. And what they say is one syringe can treat at least one arch.
Oh, okay.
And that was my experience, that there's enough in there. Now, if you have someone that has extremely deep, periodontal pocketing, then you may not get quite that much out of it. But yeah, so it's not a per site, it's more
Okay.
a broader treatment.
So that's going to affect how you charge out for it, how you bill for
Mm-hmm.
it, because you have to make sure that the code you're using, is it per tooth, is it per site? Because that really does make a difference in how you bill out for it. And
Yes.
I know a lot of offices do the testing for the different types of
Yeah.
pathogens
Mm-hmm.
there. Is this for any pathogen? Is it pretty much across the board, or does it work specifically on certain bacteria? Or is it pretty much
Uh,
just a shocker for all the bad
Yeah,
stuff in there?
it's a shock. So it's going to kill the microbes.
Okay.
And, one of the questions that's coming into my mind that I know will be asked that I don't have the exact answer to right now, but I know that the folks at Hybenx would, is like, does it also kill all the good bacteria, right? Because that's
Yeah.
something that we also need to be concerned and aware of as well. But yes, it's not pathogen specific with regards to it's only going to work on PG. It is going to work on those anaerobic bacteria that are down in that pocket. So it's pretty effective in that regard.
Would you like to hear more? Follow the link for the full episode.